My name is Peter Chalmers and I am a shoulder and elbow surgeon at the University of Utah. The purpose of this video is to explain how to apply the sling that we commonly use after surgery, how to put the sling on, how to take the sling off, how the sling works and how you should use it and how you can use it. So the first thing to explain is that there are two parts to the sling. Part number one is this portion, which supports the arm with a strap that goes around the neck. Part number two is this portion, which is a pillow that goes between the arm and the body, that then has this strap that goes around the waist. You'll notice that these straps are separate and integrated into each one of these parts. So we're going to show the sling first with just the part that supports the arm and that goes around the neck. So the way that this works is it has this clip here that you can press on either side, and then this strap will come undone. That's the first step. Then you can take the sling and place your arm within it, just like this, and then grab the strap and bring it over the shoulder to clip in this way. And then this thing's applied. The standard way to wear the sling is that your elbow should be at the depth here of it, and the hand should be nicely supported like this. Over time, with use of the sling, it will tend to rotate this way, and then it's not doing its job. So over time, you may need to pull it so that the elbow, again, is in the depth of the fold here of the sling to support the arm. Generally, after the surgeries we do on the shoulder, we just require this portion of the sling. It's very, very uncommon that we ever would require anyone to also use the pillow. But some people tell me that the problems with this are that the elbow is right next to the body and that this portion of the arm can become hot and irritated, especially in the summertime. Some people also don't feel that this provides as much support as they would like, because you'll notice that it does when you move a little bit. So we also provide this extra portion. This pillow goes between the arm and the body, just like this. And the two pieces Velcro together. And it comes with this ball, which you can use for squeezing, which helps to reduce swelling in the hand. And then there's this strap that comes across the back, and this portion then goes around the waist. So the pillow then provides additional support for the arm, and it also provides this additional stability through this waist strap. That's optional. If you like that better, that's great. If not, then that's also great. So the way to take this off is that then you would release these two snaps, and then the arm will slip right out and the straps will come out, just like that.